Let's start with where decisions regarding how Oregonians receive healthcare are made. Policy begins with the recognition of a need or problem identified through community feedback, public data, or within the system itself. Advocates take that information and develop potential solutions to address this issue. Once a proposal is ready, it is then introduced as a bill to the legislature. Each legislative session, the Oregon House Committee on Healthcare serves as a forum for advancing policies that influence healthcare delivery in our state. The question for today is, what exactly is the role of the Oregon House Committee on Healthcare? Thank you for joining me today, and welcome to What the Heck? Health Education Conversations, a podcast from the Oregon Primary Care Association. Here we explore the health policies, partnerships, and care teams shaping community health across Oregon. From healthcare delivery to workforce challenges, this podcast brings you conversations that inform, inspire, and spark the transformation of care to sustain a reliable, high-quality network for those in the most need. Each episode features conversations with primary care leaders and partners working to strengthen Oregon's healthcare safety net, as well as expand access to care for all Oregonians across our state. I'm your host, Dani Gehrke, and I'm curious, what the heck is going on in community health? Before we dive in, I'd like to thank RX Fusion for making these conversations possible and for their dedication to improving patient health outcomes by allowing primary care providers to dispense life-saving medications directly to patients. I'm sitting down with Representative Ed Diehl, one of the vice chairs of the committee. Tell me a bit about yourself, especially why the health system matters to you.
I represent House District 17, which covers East Salem through the Santiam Canyon, and I am new to politics. I was first elected in 22. That's the first time I was elected to anything. So getting into the political realm is very new to me. And I was asked when I was first elected if I would serve on the healthcare committee.
Very interesting that you were invited as soon as you started as
Well,
representative.
Just to be frank, people aren't necessarily chomping at the bit to join the healthcare committee, and there's a lot of heated, meaty topics that we take on. So it is very time consuming. But the reason I was asked is, for one, I'm on the board of a hospital, so I serve on the board of Santiam Hospital and Clinics, and I also serve on the board of Catholic Community Services Foundation, which crosses into the healthcare field, definitely. So basically, what's transpired is since I've been on the board of the hospital, I've gotten immersed in healthcare issues in a way that I never was before. But I can tell you why it's important to me. We need a healthy community, we need an effective and accessible healthcare system. When I got onto the committee, I got to learn in a more intimate level how the Medicaid system works and in some cases doesn't work. So I believe everyone needs access to good care, and healthcare is a complicated topic. It really is. And I like diving into those kinds of policies and I like solving problems. And we got lots of problems with healthcare. So
Oh my goodness, that's so true. My space is very much just amplifying what providers and our health centers do. I've been in advocacy, but I will say that once I started working with Marty, I was like, okay, you need to explain to me the legislative process because I have not been in school for a very long time. Right? And so, can you share what the focus of the healthcare committee is, especially your role as vice chair?
yeah, so up until this year, the healthcare committee was combined with behavioral health, just an FYI. So we had healthcare, behavioral health. We had the biggest workload of any committee in that building. So now that's been split. So there's a behavioral health committee, and then I'm on the healthcare committee. So we're dealing with a lot of issues that relate to providers and payers, Medicaid and commercial. We don't get into Medicare, but everything else we touch on because it is so highly regulated. I'd say the overriding theme for us is we want access. We want to make sure that if you need a primary care physician, you can find one in a few days, not weeks or months. For an example, I'm very sensitive to the provider perspective and making sure that they're being adequately compensated for the services that they deliver. And that's really a challenge right now, especially with Medicaid.
Thank you. I know that many health centers and other primary care settings are preparing for a lot of changes, especially with reporting on how they demonstrate their value as well as effectively provide care.
Right, right.
And I assume that it's going to be the same for many other primary care settings.
We're kind of in a crisis point with Medicaid. We're going to have to be spending a lot of time on that issue. What's it going to be like now that we're dealing with all these federal changes and we're dealing with CCOs that are struggling and providers that are struggling?
Not just health centers.
Right.
What do you see as the most pressing challenges of healthcare delivery in our state?
I would say it's our Medicaid system. I think that's the number one thing. We have been very generous with our Medicaid system. If you look at the expenditures, just the state expenditures over the last 10 years, it has grown significantly. And the healthcare portion of that has also disproportionately grown. So we've built a system to cover as many people as possible. And I think we've built a system that we can't afford anymore. And so we really have to look, are we making the best use of our healthcare dollars? And we have to look at it that way. So we have to look at eligibility requirements. We have to look at our benefit plans. We have to look at what kind of reporting requirements and administrative things are we putting on providers that are increasing their costs? What about legislation that has increased provider costs? There's some things that Oregon has done through legislation that make it uniquely expensive to deliver care in our state. And so we got to look at all these things. And I'd say this might be a good place to talk about it because I don't think that we really do a very good job of looking at the Medicaid delivery holistically. So I look at it this way, and I'm an engineer, so I got a budget and I've got a population of people that we need to cover. And what is the most effective use of those dollars to basically optimize health? And I can't give you that answer. What I would love to have as support for the legislature is an impartial group that is looking at it in those ways and saying, okay, we got this money, we have this population we're covering. What should that benefit package look like that's making the best use of those dollars? And how should that be distributed? And having conversations with the legislature so we can make much more informed decisions. That really doesn't happen. In my brief experience in the legislature, we look at little bits and pieces. We'll hear about this treatment. Oh, that's nice. Let's go ahead and add that. I'm adding it. I'm in a vacuum. I'm not looking at the whole picture. So what's going on right now is we're in this crisis stage and we know we have to make changes. We built a system we can't afford. We have Bruce Goldberg, who's come back. He was the first health authority director, right? And one of the architects of the coordinated care organizations. The governor's brought him back, and he's looking at it in this way. And I think that's a healthy thing to do. I'd rather do it on an ongoing basis and not, I don't want to have to call a guy out of retirement to come and help us every time we get in a mess. But I have appreciated that he's meeting with payers and providers and interested parties, and that's great. And then I'm part of a very small group of legislators that are doing follow up meetings with him to understand what's going on in that group and to also provide Bruce some feedback.
It's interesting. Are the legislators meeting with Bruce Goldberg all on the healthcare committee or interested individuals?
I think everybody is a chair or vice chair of a committee.
Okay.
So it's the chairs and vice chairs on the House side and the Senate side, I think, have all been invited. So anyway, that's a long-winded answer to the problem, which is we need to be doing this kind of thing on an ongoing basis. So we're making good, informed decisions about the whole system and not just bits and pieces.
Yeah, I appreciate how thoughtful your answer is. I don't think it was long winded at all, especially when you brought up looking at it very much from a systems point of view.
Yeah.
And we have a member who is part of the advisory group on Medicaid sustainability. And we've also been keeping track of how those conversations have been going. There are so many complexities that go into the healthcare delivery system, and there's so much that the committee has to look at as well. I'm really interested in hearing you share, what do you wish you had more time to dig into?
Yeah, that's an excellent question. I think I'd go back to the Medicaid issue. I would love to investigate in detail how other countries do this effectively. I think it would be worthwhile to kind of understand some of those models and see if they work for us.
Hmm.
We're a big country and our state is so rural. We have a lot of challenges just because of the rural nature of our state. I would really love to do a deep dive into that because I do look at it as a system and how do we most effectively, deliver that care. We put a lot of demands on our primary care physicians to be everything to everybody. They're the therapist as well, and they're responsible for making sure their patient goes to see the dentist. And there are some primary care physicians that have embraced that and seem to do a good job with it. They built systems. They have other people that can deliver those pieces and it actually helps them control their costs. But I also think that that is not going to appeal to a lot of other doctors.
I know that many healthcare providers will come to the Hill and present testimony to the committee. What strikes you the most about their statements?
Yeah. The themes that come up, a lot of it is related to the administrative burden. They're delivering the same care, the same medicine, but they got to fill out the form all these different ways depending on who the payer is. The other one is just the reimbursement rates for Medicaid are low. We have a limited amount of dollars and we've spread it across this big population, the ones that everybody thinks of when they think of healthcare. It's your primary care doctor. It's the ones that are delivering direct healthcare. We're shortchanging them in an effort to get limited set of dollars across as big of a population as we can and expanding the scope of services. I mean, we're buying air conditioners now with Medicaid dollars. And housing subsidies and food subsidies. So we're really not moving the needle, but it's costing us a ton of money. And we're shortchanging the ones who are truly delivering the care and truly showing a return.
Oh, thank you. I really appreciate that insight of what you're personally working on in addition to what the committee is looking at
Yeah.
as a whole.
As we come to the end of our conversation, it's worth reflecting on what we heard from Representative Ed Diehl. His perspective underscores that members of the Oregon House Committee on Healthcare are tasked with and committed to improving access to care for communities across the state. While much of the committee's work takes place in hearing rooms and work sessions, its impact is felt far beyond the walls of the Capitol, in our communities, in our health centers, and in the everyday experiences of patients across Oregon. The policies they shape influence what care looks like, how Oregonians access it, and how it's ultimately delivered. And while health policy is constantly evolving, today's takeaway is straightforward. Oregon's lawmakers are thoughtfully and actively grappling with what it means to ensure access, affordability, and quality of care for all. On our next episode, I'll be speaking with Representative Cyrus Javidi to learn about his firsthand experience providing dental services as the dental director at Tillamook County Community Health Centers. I'll ask what being a dental provider means to him, what the difference between providing care through a private practice versus a federally qualified health center is, and the importance of healthcare advocacy. If you don't want to miss the next episode, make sure to subscribe to this podcast to receive notifications of when new episodes are released. Today's conversation was produced and edited by Dani Gehrke and fact-checked by Priya Thoren, who also helped with research. We are extremely grateful to Representative Ed Diehl for taking the time to sit down with our team. I'm Dani Gehrke with the Oregon Primary Care Association, and thank you for listening.